Hi, I am Dr. Sakir Mansoor, and today I will discuss with you the general aspects of the joints. So, the learning objectives describe the structural classification of joints, that is, fibrous, cartilaginous, and synovial, along with their subclassifications with examples of each, and list the general characteristics of synovial joints, and list the factors stabilizing a synovial joint, and describe the Hilton's law. So the giants. Definition of giants is a place where two or more bones come together. Whether or not movement takes place between them is called a joint, right? So this is the definition of joint. So let's move on to the giant classification. So the giant classification, three chief types of joints depend on tissues that lie in the joint space between bones. Number one is the fibrous joints, number two is the cartilaginous joints, and number three is the synovial joints. Here you could see this. These are the various pictures. I will discuss these one by one, these three types. Number one is the fibrous joints. Here, articulating surfaces of bones are strongly linked by the fibrous tissue that fills joint space. Here you could see this. This is the suture. Here you could see this. This suture is an example of the fibrous joint. They very slight movement occurs at these joints. Negligible amount of movement takes place. I told you example is the suture of the skull vault and the interosseous membrane. These are the membranes. This is the radius and ulna of the forearm bones, and between them a membrane is present, interosseous membrane. So after fibrous joints, we'll take on the cartilage joints. Here, space between articulating bony surfaces is full of cartilaginous pad. Two types of the cartilage joints are synchondrosis and symphysis, right? So these are the cartilaginous joints. See the picture, follow my laser, red laser. These are the primary cartilaginous joints, which is to be the epiphyseal plate, and this is the secondary cartilaginous joints, which the example is the intervertebral disc. These are the vertebra, follow the laser, and this is the intervertebral disc. So two types, synchondrosis. First type is that cartilaginous joint where articulating bones get united by a bar or plate of hyaline cartilage, right? Epiphyseal plate between epiphysis and diaphysis of a growing bone is a temporary form of the synchondrosis. Here you could see this. This is the epiphyseal plate between the epiphysis, this part, follow the laser, upper portion. This is the epiphysis, and this is the shaft, the diaphysis. Between them, this temporary joint is the epiphyseal plate. So, first sternocostal joint that exists between first rib and the manubrium sterni is a permanent synchondrosis, right? No movement at all takes place in synchondrosis. There is absolutely no movement. So the symphysis now, it is a cartilage joint where the bones get united chiefly by a pad of plate of fibrocartilage. Here you could see this is the intervertebral disc, which is a plate of fibrocartilage. Symphyses are situated along midline of the body, right? Obviously, this is the vertebral column, the midline of the body. Intervertebral joints between vertebral bodies, and the manubriosternal joint and the symphysis pubis, right? Between symphysis pubis is between the hip bones. A minor amount of movement occurs in symphysis. There is a minor amount of movement. Now the last very important synovial joints, right? The synovial joints, here articular surfaces of the bones are covered by a slim layer of the hyaline cartilage and are separated by a joint cavity which is fluid filled, right? Here you could see this separated by a joint cavity which is fluid filled, right? Here you could see this. This is the joint cavity. Let's zoom in for you this picture. Let me zoom for you. I'm trying to zoom that. Yes, it is. I think laptop is hanged. It's not getting zoomed. Anyways, so joint cavity is lined by synovial membrane that spreads out from margins of one articular surface to those of others. Here you could see this is enlarged already. Zoomed one giant capsule is there. You could see this. This is the fibrous capsule outer, and inside it is lined by synovial membrane, and inside it is the joint cavity containing the synovial fluid, or you can see the laser and the asterix. All right. A strong fibrous membrane termed the joint capsule safeguard the exterior of synovial membrane. A viscous fluid termed synovial fluid, which is produced by synovial membrane, serves to lubricate articular surfaces. You could see this, I told you already. Giant classification continues. In some synovial giants, for instance, knee joint, the temporomandibular joint, discs or wedges of fibrocartilage are interposed between articular surfaces of bones. These are termed articular discs. Here you could see this is the temporomandibular joint, right? And here you could see this. This is the articular disc label, and here you follow the laser. This is the articular disc, right? So let's zoom the articular disc. Here you could see this is the articular disc labeled over here for you. This, right? Present in which joint? TMJ, temporomandibular joint. So the classification continues. Some synovial joints, for instance, hip joint and knee joint, have fatty pads that lie between synovial membrane and fibrous capsule or the bone. Shape of the bones taking part in the joint approximation of the adjacent anatomical structures, for example, the thigh against anterior abdominal wall or flexing hip joint, and presence of the fibrous ligaments uniting bones all take part to limit the degree of movement in a synovial joint. Most of the ligaments lie outside the giant capsule and are termed the extracapsular ligaments. Nevertheless, some important ligaments, for instance, cruciate ligaments in the knee, lie within the capsule and are called intracapsular ligaments. I'm telling you for your interest that my videos are there in the learning anatomy uploaded already on various joints of the body. Synovial joint classification, now very, very important. Synovial joints are the most common type of joint, right? These provide free movement between bones they join. So the hallmark is the free movement. That is why they are called synovial joint. These are the giants of locomotion, characteristically of almost all limb joints. For example, a shoulder joint, which is the most mobile joint of the body. These are classified according to the shapes of the articular surfaces and the types of movements that take place. There's six main types of synovial joints. Number one are the plain joints. Here you could see this acromioclavicular joint. Here you could see this. This is the acromia. You could see the labeling. This is acromion. Follow the laser. And this is the clavicle. The joint is the acromioclavicular joint. These allow gliding or sliding movement in the plane of the articular surfaces. The opposed surfaces of the bone are flat or nearly flat, with movement restricted by their tight joint capsules. These joints are plentiful and are almost always very small. So, right, they have a tight capsule and they limit the movement. Example is the, I told you, acromioclavicular joint. And this is a more elaboration of the joint, the plane joint. Plane joints is usually uniaxial, permit gliding or sliding movements, right? This is the acromion, showed you already. This is the clavicle. So this joint is the, follow the laser, acromioclavicular joint, right? This is the, and this is the schematic diagram showing the plane joint. Here you could see this one surface and one opposite surface coming together and making the plane joint. Second is the hinge joint. They allow only flexion and extension movement which take place in one plane, that is sagittal plane, around a single axis which runs transversely, right? So as a result, hinge joints are the uniaxial joints. Joint capsule of hinge joint is a thin and loose anteriorly and posteriorly to allow a flexion and extension of the, for example, elbow joint, and where movement takes place. Nevertheless, bones are united by strong laterally located collateral ligaments. For example, I told you elbow joint, say hinge joint. Only flexion extension taking place, no other movement. This is the hinge elaboration more, right? You could see this. This is the humerus of arm bone, and this is the ulna and radius, the forearm bones. Make a joint here, the elbow joint. This is the hinge representation in a schematic diagram. Hinge joints are the uniaxial permit flexion and extension only. Here you could see this is the, here if you come this part over here, this would be the flexion, and when it goes back over here, right, increasing the angle, that is the extension. So in flexion, the angle between the bones, the surfaces is decreased, and in extension, it is increased. So the saddle giants, very interesting. They're the saddle giants. Here you could see this. This is the trapezium, right? One of the carpal bones laterally in the upper limb arm, and the forearm rather, and the hand. This is the metacarpal of the thumb, right? First metacarpal. So that is why it is called carpometacarpal, first carpometacarpal joint. You could see these surfaces are opposite, and they are concavo-convex. This is the convex surface of bone, and this is the concave one. That is why they are called saddle joints. Abduction and adduction takes place as well here. Flexion and extension takes place. They take place around two axes and right angles to each other. As a result, saddle joints are biaxial joints which permit movement in two planes, sagittal plane and the frontal plane. Occurrence of these movements in a circular sequence called circumduction is also possible, right? So the word circumduction. Opposing articular surfaces are designed like a saddle, that is, these are reciprocally concave and convex. You can see again reciprocally concave and convex. This is concave trapezium surface, and this is the metacarpal. This is the convex surface. So the example carpometacarpal joint at the base of the first digit thumb is a saddle joint. This is the saddle representation. This is the trapezium, the carpal bone, and this is the first metacarpal, right? Carpometacarpal joint, first one. This is the saddle joint. Here you could see this. It's a saddle joints, biaxial saddle shaped heads permit movements in two different planes. Told you already. Here you could see this in a diagram. This is the concave surface, and this is the opposing, and the convex surface, right? You could see this. They make this joint, right? So the movements shown over here already. So the condyloid joints now, they allow flexion, extension in addition to abduction and adduction. Hence, condyloid joints are also biaxial joints. Nevertheless, movement in one plane, that is sagittal, is commonly greater than or the freer than in other. Circumduction more limited than that of the saddle joints also occur. Example is the metacarpophalangeal joints, knuckles, and the condyloid joints. This is, you could see, this is the metacarpal, right? And this is the phalanx. So that is joint to follow the laser is called as the metacarpophalangeal joint, right? I told you already which movements occur over here. Flexion and extension as well, and abduction and reduction. So this is the phalanx, and this is the metacarpal. This is the condyloid joint. This is the diagrammatic representation again, a schematic. This is the metacarpal. I already shown you this is the proximal phalanx. And here you could see this is the condyloid joint. This is biaxial, permit flexion and extension, abduction and adduction, and circumduction. Here you could see the arrows, and these are the surfaces of the condyloid joint. And the ball and socket joint, very important, very common, allow free movements. They permit movement in many axes and planes. Flexion and extension occur here, abduction and reduction, medial and lateral rotation, right? So now the a new movement over this ball and socket joints, medial and lateral rotation, and the combination all of these above, the circumduction. So the ball and socket joints are multi-axial joints. These are highly mobile joints where the spheroidal surfaces of one bone move within the socket of another. Like you could see, this is the hip joint, this is hip bone and head of the femur. So this is the socket of the hip bone, the acetabulum, and this is head of the femur. This is the ball head of the femur, and this is the socket, the acetabulum of the hip joint. You can see spherical head of the femur rotates within socket formed by acetabulum of hip joint. Hip bone. Acetabulum of hip bone, right? Here you could see this, and the head of the femur, right? And this is, you could see, this is the schematic diagram. In ball and socket joint, which is the multi-axial, a rounded head fits into a concavity permitting movement in several axes, right? This is the concavity. You could see the socket, and this is the ball. So the ball and socket movements, and these are the movements taking place in various directions. And it's a last, the pivot joints, right? You could see this interesting. This is the axis, which is the second cervical vertebra, and this is the atlas, right? This is the axis and atlas. This is the part of the axis. The second vertebra is dense, right? So pivot joints allow rotation around a central axis. As a result, they are uniaxial. They are uniaxial. In pivot joints, a rounded process of bone gets rotated within a sleeve or ring. Right. This is the rounded process, dense of the axis, and rotates within a sleeve or ring over here. Example is the median atlantoaxial joint. They will form a median atlantoaxial joint. This is a pivot joint where atlas C1 vertebra rotates around a finger-like process, the dance of axis. This is again you see dense C2 vertebra during rotation of the head. Here you could see this is the articulated first and the second vertebra. Here you could see this is the dense, this is a making joint, median atlantoaxial joint. So atlantoaxial joint, pivot. This is the schematic diagram. In pivot joints, uniaxially rounded process of bone fits into a bony ligamentous socket permitting rotation. Here you could see this. This is you could say a sort of socket, and this is a rounded process of bone. It is fitting into that, and that permits rotation. So very interesting, joint stability. Stability of a joint can be determined by three chief factors, but especially this stability is important for movable joints, the synovial joints. They get more important over here. Morphology of bony articular surfaces, ligaments, and the tone of muscle around joints. These are the three factors I will tell you one by one in detail. This is joint stability factors. First of all, you could see this articular surfaces opposing their congruity. For example, these are the ligaments, right? These are the intracapsular ligaments, the cruciate ligaments, and this is the medial collateral ligament. And this is the muscle, fibularis longus muscle holding up lateral longitudinal arch of the right foot. Here is the muscle tone. Here you could see the tendon going on into the sole of the foot. So the number one in detail I will discuss with these factors, the stabilizing factors, the morphology of the bony articular surfaces. In some joints, shapes of the bones and their articular surfaces cause bones to produce a comparatively tight-fitting framework which give overall stability to joints such as ball and socket arrangement of hip joint and mortise arrangement of tarsal bones in the ankle joint. Yet in a few other joints, shape of the bones contributes negligible or nothing to the joint stability. For instance, knee joint, calcaneocuboid, right? The calcaneocuboid is also a weak joint, and the acromioclavicular joint. Knee joint is actually a weak joint structurally. Here you could see this is the stable joint, the hip joint with a lot of movements, synovial joint, and due to its congruity, this is the acetabulum, which also contains a rim around that, which is the acetabular. You could say cartilage made of cartilage. This is the hemispherical head of the femur, which would be the acetabular labrum. This is the fibrous ligaments role, avoid extreme movement in a joint. But if stress is continued for any overly long period, then fibrous ligaments get stretched. For instance, ligaments of the joints between the bones forming arches of the feet will not support the weight of the body. Should the tone of muscles that typically support arches become impaired by fatigue, then ligaments will stretch and arches will get collapsed, resulting in a flat feet. Elastic ligaments, on the other hand, come back to their original length after stretching. The elastic ligaments are of auditory ossicles play an active part in supporting giants and helping return of bones to their original position after the movements. You know, auditory ossicles, three in each ear, right? These are the stapes, incus, and malleus. And this is the knee joint cruciate ligaments, and these are the medial collateral ligaments. If somebody is interested in videos, I have all the videos: the knee joint, hip joint, and the ankle joint at my channel, Learning Anatomy, and also the shoulder joint, elbow joint, and the wrist joint. So in the last stability factor is the muscle tone. In majority of the giants, muscle tone is the chief factor contributing to stability. Example is the muscle tone of short muscles around shoulder joint hold on to hemispherical head of the humerus in shallow glenoid cavity of the scapula, right? They are the muscles of the rotator cuff. So minus the action of these muscles, very less force will be required to dislocate shoulder joint. Knee joint is quite unstable without tonic activity of quadriceps femoris muscle. Joints between small bones forming arches of the feet are mainly supported by tone of leg muscles whose tendons are inserted into bones of feet. Here you could see, I told you already this picture. Yeah, right. This is the fibularis longus, the peroneus longus muscle holding up lateral longitudinal arch of the right foot. Here you could see this is the lateral, this is lateral side and longitudinal arch, right? So, joint nerve supply now. Giant capsule and ligaments obtain rich sensory nerve supply. A sensory nerve supply a joint also a sensory nerve that supply a joint also supplies muscles that move the joint and the skin that overlay insertion of these muscle effect that has been termed as Hilton's law or the Hilton's. So this is the Hilton's principle or the Hilton's law, right? You could see this. Any sensory nerve that supply a joint also supplies muscle that move the joint and the skin that overlay insertion of these muscles, right? So the giant vasculature, giants obtain blood from the articular arteries that originate from vessels around the joints. The arteries usually anastomose that is communicate to constitute network peri-articular arterial anastomosis to make sure a blood supply to the and across the joint in various positions assumed by joint. For example, there is around the knee joint is the genicular anastomosis. Articular veins are the communicating veins which go together with arteries. That is the venae comitatus, and unlike the arteries are situated in the giant capsule, usually in synovial membrane. This is the last slide, and the lymphatic drainage of the synovial giants. Lymphatics make a plexus in subintima of the synovial membrane, and that gets drained along the blood vessels to regional lymph nodes. So thank you very much for watching my video. So to subscribe and share, please. Thank you very much. Goodbye.